Um, my presentation is focusing on celiac disease, which we learned a little bit about under the digestive system unit. The specific study that I was pulling my information from is called the effectiveness of treating previously untreated patients with both a gluten-free diet and a phosphate drug versus a gluten-free diet alone. To get started, I'd like to say a few things about what celiac disease actually is and some key terms. It is an autoimmune disease that occurs in individuals with a genetic predisposition, meaning that they were either born with it or inherited it from a family member. It is not something that can occur over time. When the gluten is digested, uh, through the mouth and through the digestive system, when it occurs in the small intestine, damage may result. Um, Gluten actually is a protein found in rye, wheat, and barley. It causes the body to send immune response that will ultimately attack the small intestine. These attacks mainly are focused on the villi, which are finger-like projections that promote the absorption of nutrients into the small intestine. Um, some conditions that have been found to be caused by celiac disease itself um, are osteoporosis, rickets, and osteomalacia, and that is commonly a result of the malabsorption of calcium during infancy and childhood, and that is what causes these conditions. Some key terms that I want to focus on is a gluten-free diet, and it's often referred to as GFD, which means it removes all the wheat, rye, and barley from the diet. Five biophosphate drugs themselves are drugs that work to slow down the breakdown of bone density, and this is done by inhibiting the osteoclast activity, which are bone eating or like bone breakdown cells. This study uses a dosage of 5 milligrams per day of the biophosphate medication, and it is shown to prevent bone loss at the hip and the lumbar specifically, which makes up a lot of the weight of the body. The patients that were um, used in this study consists of 30 children below the age of 15, and that's because it's good to get this stuff started, these treatments in childhood, so that their condition doesn't progress. The patients were required to have been diagnosed with celiac disease, but they had to be untreated so that no other medication or interventions would have skewed the results. Physicians diagnosed the patients by a clinical presentation, which included a small bowel histology and serological testing, which is blood tests that specifically look for antibodies. And we know that the antibodies are present and that celiac disease is happening because that immune response is being sent to the small intestine. 15 of the patients were treated with the gluten-free diet alone, which made up group 1, and 15 were treated with a gluten-free diet along with the biophosphate drugs, and they made up group 2. The patients alone were 18 of them were female and 12 of them were male. The average age for those patients ranged about 7.5 years, give or take 2 years, in group 1, and about 6.5 age, give or take 4 to 3 years in group 2. After 3 months of the interventions, both with group 1 and group 2 being the gluten-free diet alone and the gluten-free diet with the biophosphate drugs, patients that had other bone diseases or had problems with their mineral metabolism were excluded from the study so that we were focusing solely on those patients with celiac disease. Uh, Malabsorption was the most common symptom in the 18 patients, meaning that they weren't able to get the nutrients that the small intestine usually absorbs through digestion, um, one being calcium. And a height deficiency was common in 15 of the patients, which could be a common result